Welcome. My name is Hillary Rankin, and I'm going to discuss the Healthy Life, Healthy Heart program, a DNP guided primary prevention program for teen girls on cardiovascular health. We will start off about talking about heart disease and exactly what it is, specifically hyperlipidemia, coronary artery disease, and acute myocardial infarction, since that is what the education in the program will focus on. We will then move on to heart disease in women, their specific mortality rates, signs and symptoms, and risk factors. We will then move on to the Healthy Life, Healthy Heart program. We will elaborate on the education points and who will be involved, along with the role of the DNP educated nurse and their necessary leadership competencies. Finally, we will discuss how the program will be evaluated for success. So, what is heart disease? Heart disease is a general term used to describe several disease processes, most of which are related to atherosclerosis. On the slide, I provided you with the current definition of atherosclerosis as deemed by the American Heart Association, along with the most common types of heart disease according to the American Heart Association. Hyperlipidemia is a disorder characterized by an increased level of lipids present in the bloodstream. These lipids stick to the walls of the arteries and put one at a major risk for several medical problems, including heart disease and stroke. Moving on to coronary artery disease, or CAD for short. CAD is atherosclerosis found in the coronary arteries. This restriction of blood flow to the heart, or ischemia, can be acute or chronic. As you can see, several of the risk factors listed for CAD play into one another. For example, sedentary lifestyle, itself a risk for coronary artery disease, puts one at risk for obesity, which in turn increases a person's risk for CAD. This is why it is vital to educate people on how to reduce their modifiable risk factors. In a natural progression off of CAD, we will now take a look at acute myocardial infarction, or AMI for short. This is most commonly known as a heart attack. CAD is the leading cause of AMI according to the Centers for Disease Control and Prevention. The ischemia to the heart leads to eventual heart damage. The longer it takes for someone to seek treatment for AMI, the more heart damage is done. This is extremely dangerous considering 1 out of 5 cases of AMI passes with minimal symptoms, and the damage to their heart happens without a person ever knowing about it. The amount of heart damage can oftentimes be fatal. For women in particular, heart disease is extremely deadly. The CDC reports that it is the leading cause of death in women in the United States. On the slide, I have provided you with some startling statistics about heart disease in women provided by the CDC. In the local area of Calhoun County alone, heart disease was attributed for the death of 283 women in 2015. This number, in relation to the size of the population and total number of deaths, was equivalent to over 500 per 100,000 deaths in white women and greater than 370 per 100,000 deaths in minority women in the county in 2015. To the right, I have provided you with a graph that represents the distribution of heart disease throughout the United States as provided by the CDC. Risk factors for CAD are often the same risk factors as are present for men. One additional risk factor that women have is long-term hormone replacement therapy in postmenopausal women. Research is still being conducted with the relationship between estrogen and heart disease. The signs and symptoms of AMI in women are oftentimes more difficult to identify than they are in their male counterparts. Although some women will report typical crushing chest pain, it is not uncommon to see a woman present to a hospital with nothing more than an increased fatigue and jaw pain who is experiencing a massive AMI. Here we can see that women have a wider variety of signs and symptoms than men. It is important that we educate all women of what vague symptoms they may experience with heart disease. This is where the Healthy Life, Healthy Heart program comes in. Inspired by the Wise Woman campaign that works with middle-aged women as a secondary prevention method for heart disease and stroke by providing free screenings for risk factors, the Healthy Life, Healthy Heart program will focus on educating teenage girls aged 13 to 19 about the dangers of heart disease and what they can be doing now to reduce their risk of heart disease later in life. The process will begin with local health educators in high schools and middle schools administering pre-tests to assess the knowledge about cardiac disease. Simultaneously, school nurses will be recruiting eligible teenage girls to complete weigh-ins and 1 week-long diet and exercise logs. BSN students from a local college will present lectures on cardiac disease in women and how to reduce risk factors to eligible girls aged 13 to 19 in the area. 6 months post-presentation, the students will be retested, reweighed, and once again complete activity and diet logs for a week. This information will be turned over to the DNP for data compilation, and once she gathers the results, they will be distributed to the school nurses to aid in assisting girls in developing plans to reduce risk factors most prevalent at their school. The education of the Healthy Life, Healthy Heart program will focus on modifiable risk factors, but will also touch on non-modifiable risk factors such as genetics. Primarily, we will discuss diet, activity level, and tobacco use. Healthy diet will be one of the key points of the Healthy Life, Healthy Heart program. Among children 2 to 19, over 30% are overweight or obese, and close to 17% are obese. We will discuss the recommended serving size of whole grains, vegetables, and fruits, and in general will encourage less carbohydrate and simple sugar intake, increased amounts of whole grains, raw vegetables, and fruits, and how one can substitute legumes in the place of red meats in their diet. This is a chart provided by the CDC that shows the increase in carbohydrates and fats in the diet over the past several decades. Hopefully, with education, we can see a decrease in carbohydrates and fat, as this has been shown to reduce the heart disease. Next, we will discuss activity level with the girls. Over 20% of adolescents report no physical activity lasting longer than 60 minutes in a week span. The American Heart Association recommends greater than 60 minutes of activity for 5 or more days a week, every week. We will encourage this amount of activity and give suggestions other than the traditional cardiac activity of running, such as biking, dancing, and swimming. We will also encourage ideas from the participants on other ways to promote physical activity in their community. We will talk very heavily on tobacco use. We'll teach very heavily on tobacco use. In 2009, in grades 9 through 12, close to 20% of students reported current cigarette use. According to the CDC, even people who smoke less than 5 cigarettes a day can have signs of early heart disease. It is essential that these young girls stop smoking immediately. We will provide them with effective methods for smoking cessation, including local support groups, nicotine replacements, and distraction methods. We will also touch on genetics. Among young adults, more than 13% have reported having a parent or a sibling with angina or a heart attack before age 50, according to the American Heart Association. A paternal history of premature heart attack increases the risk of heart attack by close to 70% in females. It is important for these girls to understand their genetic risk for heart disease. Although it's not a variable that they can change, it's always something they should keep in mind, and those with a familial history of heart disease should be extra cautious and really try to reduce their modifiable risk factors. The Healthy Life, Healthy Heart team is interdisciplinary and will include a DNP educated nurse, a school nurse, health education teachers, and BSN students. The DNP will serve as the head of the project who will compile data, develop pre and post assessments, and distribute the results to the school. The school RN or LPN will be in charge on working with students on identifying their risk factors and developing goals to reduce them. They will also gather the data with willing students such as weight, diet journals, and activity logs. The health education teachers will be in charge of administering the pre and post assessment of heart health knowledge and finding eligible students for the program. BSN students will be in charge of the presentations to students on the dangers of heart disease, risk factors, and how to reduce those factors as part of their own community health class. The role of the DNP here is the project leader. They will be recruiting all of the participating schools and the participating BSN students. The DNP educated nurse will also develop the pre and post evaluation and assess the dietary and activity logs completed by the participating students. They also will be in charge of distributing the results back to the schools so that the nurses can work on developing plans with the students. Several leadership competencies will be required by the DNP educated nurse. Of these, communication will be one of the most important. It will be critical when developing the pre and post evaluation and in assisting the BSN students with developing their presentation. The ability to establish relationships will also be key, as this will be important in recruiting local schools to participate in the program. The American Nurses Association describes the project management competency as the ability to organize and set priorities. This will be an important skill the DNP nurse will need to organize the presentation, compile all the data, and organize all of the team members of the Healthy Life, Healthy Heart program. The DNP nurse will also need to be adaptable and be able to take ideas and be flexible with plans. They need to be able to take suggestions from the BSN students and the school nurses and health educators as the program evolves. We will evaluate the success of the program by looking at the pre-presentation and post-presentation data. Before the presentations, 13 to 19-year-old females will take quizzes assessing their knowledge of heart disease. They will also complete dietary and activity logs, which the student nurse will turn over to the DNP. After the presentations, the health educators will administer a post-test assessing the knowledge of cardiac health. Those results will be compared to the pre-test that was developed by the DNP. After 6 months, the school nurse will also reobtain weight and activity and diet logs of participating girls. This information will also be given to the DNP and compared to pre-presentation levels. The goal will be a 20% increase in test scores after presentation, a 10% weight loss by participating girls, and improvements in diets and activity levels of all participating females. In summary, cardiovascular disease is a growing epidemic for women in the United States. Hopefully, with early education, we can teach young girls to reduce their modifiable risk factors and decrease the burden of heart disease on women in the U.S.